13 alarming signs your blood sugar levels are high. Do you know more than 11% of the population of America suffers from high blood sugar, whereas approximately 8.5 million people still have not been diagnosed with this disease? High blood sugar levels, also known as hyperglycemia, are the silent killers of your health. Diabetes, if untreated, can lead to a worsening of symptoms such as heart failure, kidney problems, and blindness with each passing day. But what are some of the warning signs that you might have high blood sugar? The most reliable method is to conduct a particular blood test. However, your body might already be giving you signals about this complication. In today's video, we are going to talk about 13 common signs of high blood sugar, which you may or may not be ignoring. Always remember to check in with your doctor if you have any concerns about high blood sugar. Let's get started. 1. Feeling constantly thirsty. Excessive thirst that you may experience in diabetes is called polydipsia. It is a warning sign for your body to take serious measures to control your blood sugar. When blood sugar levels are high, the kidneys attempt to remove excess glucose by filtering it out through urine. This process flushes out valuable hydrating fluid from your body, leading to dehydration. As a response to dehydration, the body signals thirst to encourage fluid intake. Keep in mind that prolonged dehydration can cause nausea, dizziness, headaches, and fainting. In addition to that, dehydration also causes you to pee less, which stops your body from getting rid of excess blood sugar through urine. When this happens, your blood sugar levels shoot up too fast. When you feel thirsty, you need fluid to quench it. Fruits, such as cucumber and watermelon, are composed primarily of water about 90 to 95%, making them highly hydrating. It helps replenish fluids lost due to frequent urination caused by high blood sugar levels. The high water content in watermelon and cucumber aids in rehydration without adding excessive sugar or calories. 2. Urinating more frequently. If you're urinating more often than usual, your frequent urination could be a symptom of high blood sugar, which may be an early symptom of diabetes. Too much sugar in your blood is extremely taxing on the kidneys, which work to reabsorb sugar into the bloodstream. When the kidneys can't reabsorb all the sugar correctly, urination helps eliminate much of that glucose from the body. 3. Feeling tired more often. Fatigue is another common issue that comes with high blood sugar. Endless tiredness and lethargy become persistent feelings when your body doesn't get enough energy to run all the operations. Cells require glucose to break down and use it as fuel. However, glucose is mainly present in the bloodstream and requires insulin to enter the cells. When blood sugar levels get elevated, the pancreas reduces the production of insulin. This impairs glucose's ability to enter the cells. As a result, cells don't receive the energy they need, leading to persistent fatigue. Carbohydrate is required to support energy supply in the body. That's why you should add foods such as quinoa, which is a whole grain rich in complex carbohydrates, to your diet. These carbs are digested slowly, providing a steady release of energy. Consuming complex carbohydrates helps stabilize blood sugar levels and provides sustained energy, combating the fatigue associated with high blood sugar. 4. Blurry vision. You will be shocked to know that the impact of high sugar levels even extends to the eyes. Diabetic retinopathy is caused when high blood sugar damages blood vessels in the retina, a light-sensitive layer of cells in the back of the eye. Damaged blood vessels can swell and leak, causing blurry vision or stopping blood flow. Although sometimes new blood vessels grow, they aren't normal and can cause further vision problems. Keep in mind that it usually affects both eyes. Since the issue arises from damaged blood vessels, blueberries can be a great food to reduce the problem. They are rich in antioxidants, particularly anthocyanins, which have anti-inflammatory and blood vessel protective properties. Thus, consuming them can potentially alleviate blurred vision. 5. Slow wound healing. If the cut or scratch on your leg is not healing even after a few days, then you probably need to check your blood sugar level. Elevated blood sugar levels can damage blood vessels and impair circulation, which is essential for delivering nutrients and oxygen to injured tissues. This slowdown in circulation can delay the body's natural healing processes, as blood can't reach the wound in time. Additionally, many people who have diabetes also have problems with immune system activation. In this scenario, in a defective immune system, the number of fighter cells sent to heal wounds and their ability to take action are often reduced. Thus, wound healing becomes slower and your risk of infection rises even higher. To encourage wound healing, you need to supply additional nutritional elements to your body. Vitamin C is crucial for collagen production, which is essential for wound healing and tissue repair. Consuming foods like oranges that are high in vitamin C can accelerate the body's ability to form collagen, aiding in faster wound healing. 6. Constant feeling of hunger. Hunger and cravings are frustrating side effects of high blood sugar levels, which can also be very confusing sometimes. Why do your body and brain want more food if there is already so much sugar in your bloodstream that has not been used up? Glucose is an extremely crucial compound that works as an energy source for cells. However, this is not possible because people who have high blood sugar frequently have insulin resistance, which prevents glucose from entering cells in an effective manner. As a direct consequence of this, cells are deprived of the energy they require, which results in a hunger that does not go away as the body works to make up for this energy shortfall. You need to re-evaluate your diet in light of the fact that persistent hunger can lead to mindless munching, which in turn can lead to further weight gain. Including fiber in your diet helps stabilize blood sugar levels and curbs the constant hunger associated with insulin resistance. Fiber-rich foods like oats slow down digestion and promote a feeling of fullness, reducing hunger. 7. Numbness or tingling in the extremities. Another complicated sign of high blood sugar is numbness in the hand or feet, popularly known as diabetic neuropathy. This is a type of nerve damage that can occur throughout the body if you have diabetes. Depending on the affected nerves, diabetic neuropathy symptoms include pain and numbness in the legs, feet, and hands. It can also cause problems with the digestive system, urinary tract, blood vessels, and heart. Some people have mild symptoms, but for others, diabetic neuropathy can be quite painful and disabling. Remember that it is a serious diabetes complication that may affect as many as 50% of people with diabetes, but you can often prevent diabetic neuropathy or slow its progress with consistent blood sugar management and a healthy lifestyle with a suitable diet. B vitamins, including B6 and B12, are essential vitamins for nerve health and function that you may want to add to your diet to mitigate the risk of diabetic neuropathy. Consuming foods rich in B vitamins, such as spinach, supports nerve health and can help alleviate numbness or tingling sensations. 8. Excessive weight loss. Another common sign of high blood sugar is random weight loss. People who are obese may benefit from losing weight, but it is important to keep in mind that uncontrolled weight loss can lead to additional complications. When you have high levels of glucose in your blood, your body is unable to produce enough insulin to convert glucose into energy in a normal manner. That's when body cells think your body's starving and start consuming muscle and body fat instead. When a person has high blood sugar, it can cause them to have to urinate more frequently, which can lead to dehydration. It can be one of the factors that contribute to weight loss. To counter this adverse effect, you require protein-rich foods like lean chicken. It will provide essential amino acids and help maintain muscle mass. Because elevated blood sugar levels can cause the breakdown of muscle tissue for the purpose of producing energy, consuming an adequate amount of protein can assist in the preservation of muscle tissue and the maintenance of a normal weight. 9. Moody or easily irritated. You may think diabetes just affects your pancreas, but living with this condition often affects your mood and mental health too. For example, you may experience mood swings when your blood glucose levels are too high or low. Additionally, anxiety is common in people with diabetes, especially women. Between 30 and 40% of those with diabetes report having anxiety. Apart from that, up to 1 in 4 people with diabetes have depression. In fact, women are more prone to depression related to diabetes than men. But how can you deal with it? Complex carbohydrates found in whole grains, like brown rice and whole wheat bread, are slowly digested, leading to a steady release of glucose into the bloodstream. This steady supply of glucose helps stabilize blood sugar levels, preventing the mood swings and irritability often linked to fluctuations in blood sugar. 10. Fruity smelling breath. Diabetic ketoacidosis, or DKA, is a serious and potentially life-threatening complication of diabetes. This condition is more likely to affect those who have type 1 diabetes. DKA can develop if the body cannot produce or effectively use insulin to provide energy for cells. Instead, the liver breaks down fats for energy due to insufficient glucose uptake by cells, producing ketones. If a person's body produces ketones too fast, they can build up to dangerous levels. Bad breath is a sign of that. The typical odor of diabetes-related bad breath is often described as being comparable to that of sour apples or pear drops. Others may describe this scent as similar to acetone or nail polish remover. Cinnamon has compounds that can improve insulin sensitivity and help glucose enter cells more efficiently. By improving insulin function, cinnamon can reduce the need for the body to break down fats for energy, addressing the fruity breath odor associated with elevated blood sugar. 11. Frequent infections. High blood sugar weakens the immune system's ability to fend off infections. It reduces the efficiency of the body's infection-fighting white blood cells, which in turn slows down the body's ability to recover from wounds and makes the body more susceptible to infection. The hyperglycemic environment promotes immune dysfunction. For example, damage to the function of neutrophils, depression of the antioxidant system, and humoral immunity are all caused by high blood sugar. Moreover, a decrease in the antibacterial activity of urine and the gastrointestinal tract is another factor contributing to the increased frequency of infections in diabetic patients. That's why, when the body gets infected, it can't fight back properly. Skin, soft tissues, the urinary tract, and the respiratory tract are the areas of the body that are most likely to become infected in diabetic patients. In fact, abnormalities in the bacterial flora of the gastrointestinal tract can play a role in the development of diabetes. Nevertheless, probiotics are beneficial bacteria that support the immune system. Hence, adding probiotic-rich foods like yogurt to your diet can help maintain a healthy gut microbiome, reducing the risk of diabetes. Thus, you can support overall immunity while reducing the risk of recurring infections. 12. Skin problems like dryness, itching, or dark patches. Diabetes can cause damage to the nerves and blood vessels throughout the body, including those found in the skin. Acanthosis nigricans, or AN, is a skin condition that causes a dark patch or band of velvety skin in body creases such as your neck, armpits, or groin. Sometimes, the patches can also appear on your hands, elbows, or knees. It is a sign of insulin resistance and can be a sign of pre-diabetes or type 2 diabetes. People who have obesity experience this most. Additionally, high blood sugar levels can affect the skin's collagen. This can lead to a variety of spots on the skin that are yellow, reddish, or brown in color. Later, the skin becomes too hard around that area. And the worst part is that this condition, known as necrobiosis lipoidica, doesn't have a cure other than fixing your blood sugar level. Moreover, too much sugar in the blood causes the body to pull fluid from its cells so that it can produce enough urine to remove the excess sugar. This makes your skin feel dry and itchy. There is a significant correlation between increased blood sugar levels and the depletion of antioxidants. This depletion is a significant contributor to the increased likelihood of developing complications. Antioxidant supplements such as vitamin E and C protect skin cells from oxidative damage and nourish the skin as well. 13. Brain fog. Your brain is your body's command center. It is composed of nerve cells, which are responsible for keeping your body functioning even when you are asleep. It also controls how you feel as well as how you learn and remember things. And in order to accomplish all of this work, your brain draws its energy from the sugar that is found in your blood. However, fluctuations in blood sugar levels have been shown to negatively impact cognitive function. Over time, having high blood sugar can cause damage to the blood vessels in the brain, which are responsible for carrying oxygen-rich blood. Brain cells are susceptible to death whenever there is an inadequate supply of blood to the brain. This condition is known as brain atrophy, and it can lead to issues with memory and thinking, as well as eventually lead to vascular dementia. According to a study, people diagnosed with type 2 diabetes have a 50% increased risk of developing dementia. To counter this effect, you need foods rich in omega-3 fatty acids, particularly DHA. Omega-3 promotes cognition, neuronal preservation, and protection against neurodegeneration. Thus, they have been proven to have wonderfully positive effects on the short-term and long-term memory of a person. Fatty fish, such as salmon, are a great source of omega-3 fatty acids. What are the risks of living with high blood sugar? Having consistently high blood sugar, also known as hyperglycemia, poses several serious health risks. Here are some of the primary risks associated with high blood sugar that you should be aware of. Prolonged high blood sugar levels are a hallmark of diabetes. There are two main types of diabetes: type 1, where the body doesn't produce insulin, and type 2, where the body becomes resistant to insulin. Both types can result in chronically high blood sugar levels. High blood sugar damages blood vessels and increases the risk of atherosclerosis, which is the hardening and narrowing of the arteries. This can lead to heart attacks, strokes, and other cardiovascular problems. The kidneys filter waste from the blood, but high blood sugar can damage these filters. Over time, this can lead to kidney disease, potentially requiring dialysis or transplantation. Nerve damage from prolonged hyperglycemia can affect the digestive system, leading to issues such as gastroparesis or delayed stomach emptying. Uncontrolled high blood sugar during pregnancy can increase the risk of complications for both the mother and the baby. How should you manage your blood sugar level? Managing blood sugar levels is crucial for overall health, especially for individuals with diabetes or those at risk of high blood sugar. Here are some key strategies for effectively managing blood sugar levels that you may follow. 1. A well-balanced diet. Food plays a vital role in managing blood sugar levels. You will benefit greatly from limiting your consumption of processed foods and including a wider variety of foods that are rich in nutrients. Some examples of these foods include fruits, vegetables, lean proteins, whole grains, and healthy fats. Nevertheless, you should be mindful of portion sizes to avoid overeating, which can lead to a spike in blood sugar. In addition, keep a close eye on and rein in your carbohydrate consumption, as this factor has the most significant influence on blood sugar levels. If you are looking for a customized eating strategy, consulting with a registered dietitian may be a good option for you. 2. Regular exercise. Regular physical activity not only helps your body make better use of insulin, but also has the potential to reduce blood sugar levels. For a general guideline, try to aim for at least 150 minutes of moderate intensity aerobic activity per week. In addition, make it a habit to go for a walk after dinner for a minimum of half an hour. It will ensure that the food is properly burned. 3. Medication and insulin. If a medical professional has prescribed medication or insulin for you to help control your blood sugar levels, make sure to take it exactly as directed. In addition to this, be sure to keep a close eye on how high your blood sugar gets. 4. Live stress-free. High stress levels can impact blood sugar. Because of this, you should make an effort to reduce the amount of stress in your life by engaging in activities that help you relax, such as deep breathing, meditation, yoga, or hobbies. A lack of quality sleep can also increase our levels of stress. If you want to have a happier life, you should give yourself at least 7 to 8 hours of sleep each night. Keep these 13 symptoms in mind so that you will not find yourself dealing with high blood sugar one day out of the blue. Although an individual plan for blood sugar management needs specific guidance, with proper foods and exercise, you can overcome this fatal health issue. However, you must remember that elevated blood sugar can be chronic and that it requires attention. One can receive individualized guidance and support for effectively controlling their blood sugar levels by working closely with a healthcare team, which may include a registered dietitian and a diabetes educator. This allows the person to maintain effective control of their blood sugar levels. We have discussed many signs of high blood sugar, but as we know, our daily diets play a crucial role in maintaining our overall health. If you are looking for more food-related videos, here are a few more we recommend you check out. Watch 17 powerful superfoods that reduce your uric acid levels. Or try 11 powerful brain foods that can help fight dementia. Go ahead, watch one or even better, both. Do you suffer from high blood sugar levels? Tell us in the comments section below.